Hi, my name is Dr. Shane Martin. I'm a chiropractic doctor, and I have a clinic. And what we do is we try to treat or to heal people without the use of pharmaceutical drugs or surgery, just using natural means. So we try to treat or take care of emotional stress, physical stress, and chemical stress. By doing so, we try to treat the whole body. So that's just a little bit about myself. And what I plan on doing here today is I want to give you some understanding about adrenal fatigue syndrome and give you some tools so you can treat it yourself, uh, or some tips. And then thirdly, what I'll be doing is I'll give a short overview of what I do at my clinic if you haven't been to my clinic, and I'll give you an overview of what to expect. And lastly, I'll provide a discount code at the very end. So let's dive into it. So adrenal fatigue syndrome. The best place to start here is to look at the theory of disease. So with the theory of disease, you have different theories. You have the germ theory, in which case that's largely what modern medicine is based off of, that there's a germ or something outside of you that breaks your biological barriers and it infects your organs or your skin. And the way to eradicate that is through pharmaceuticals, antibiotics, antiviral drugs. So our theory of disease is we look at stress. So the body is able to handle any disease as long as there's not an overabundance of chemical, emotional, or structural stress. So what we try to do is we try to pinpoint where the stress is coming from. Is it chemical, emotional, or structural? And we remove it, and then the body is able to heal itself. So I'm a firm believer that the body is able to heal itself if you remove the blocks. So next, we're going to talk a little bit about how do you identify adrenal fatigue syndrome. So first off, some of the symptoms are, what I notice with a lot of my patients is, obviously there's fatigue throughout the day. A lot of times patients will be heavy coffee drinkers. If they stand up quickly, they'll feel dizzy or lightheaded. Difficulty sleeping. They'll have cravings for sugar or salt. Next, we'll look at stages. So there's oftentimes three different stages. You have the preliminary stage. It's called the hare stage or the rabbit stage. That's where the adrenals they're not doing too well, and to compensate, the person is drinking a lot of coffee, so they're sort of like in this fight or flight mode, and so it appears they have a lot of energy, but that's just because of the caffeine. Then as the adrenals continue to not do so well, degrade, you get to the tortoise stage. That's where they're constantly exhausted. And the only way they can function is if they get their Starbucks every morning. And then the third stage is a little bit, it's much more, you might say, severe. This is where they have absolutely no energy in the morning, regardless of how much caffeine they take. At nighttime, they can get absolutely no sleep. So oftentimes these people are exhausted and sleeping during the day, but wide awake at nighttime. Now, I'll talk about some stories. What I find is a lot of patients, all my patients, they have something called a hiatal hernia. I'll talk about that. And they have a hiatal hernia in their stomach, which means the stomach, there's a structural issue with the stomach, and there's low gastric acid. And when there's low gastric acid, you need lots of acid in the stomach to protect yourself against viruses and germs and bugs. And if you don't have that gastric acid or much of it, then the gut becomes infiltrated with viruses or parasites or an imbalance of bacteria. And that causes a stress on the adrenals. The adrenals aren't doing well. You need the adrenals in order to deal with the stress in the body. And when that happens, when the adrenals aren't doing well, that leads to inflammation throughout the body, low testosterone, increase in illness, increase in fatigue, We'll know oftentimes these people will have allergies, they'll become allergic to everything around them. So here I'll talk a little bit about hiatal hernias and disc herniations, because this is actually connected. So as you can see here, a hiatal hernia is you have a diaphragm here and you have the stomach here, and sometimes when the diaphragm weakens, structurally the stomach actually shifts up past the diaphragm, and that causes the gastric acid to become less. And what happens is these patients often have heartburns, or let's see, or GERD, gastroesophageal reflux disease. These people have to take Tums, and sometimes medical doctors will actually prescribe like maybe a surgery, and these conditions can be fixed quite easily. However, I fix it all the time. And if the adrenals aren't doing well, then your cartilage begins to degrade, which leads to a breakdown in the cartilage and the discs. So oftentimes these people will have, we call them emotional back pain. The discs between the vertebrae stick out and aggravate the nerves, and you'll often have back pain, even pain down the legs or around the abdomen. So I just want to touch on that. So next I'll talk about the axis. So again, I'm just trying to give you a little bit of background of the anatomy of the adrenals, just so you understand a little bit of the complexity of what we're dealing with, in that it's not always there's not necessarily one solution that's going to fix everything. So here, we oftentimes what we have is we have stress. It could be physical stress, emotional stress, it could be chemical stress, and the chemical stress can be from many different issues. It could be the food you eat. It could be the toxins in your environment. So what happens is the stress is picked up by your brain, by your prefrontal cortex, and eventually, let's see here, the pituitary, which is a gland, will release something called ACTH, or adrenal corticotropic hormone. This hormone will travel to the adrenals and then cause adrenals to secrete a multitude of different hormones to deal with the stress. In this case, typically it's the hormone, it's cortisol. So as stress increases, then the adrenals release cortisol. As cortisol increases, then you're going to get much less testosterone, because the adrenals are responsible for your elevation of testosterone in your body. So if your testosterone is low, that actually leads to inflation throughout the whole body. Next, we're going to look at the adrenal gland itself. So just remember, the adrenal glands are located right above the kidneys. You have two of them. They're very small. And we'll just go through the different layers of the adrenal gland. You have, let's see here. We have three layers. The first layer is responsible for sugar. The second layer is responsible for managing like salt intake, and the third layer is responsible for sex or sex hormones. So in the first layer, you're going, and it's very important. First layer, you're going to be releasing aldosterone. Actually, my mistake. Your first layer, you're going to be releasing mineral corticoid hormones, which also releases aldosterone as well. So a lot of times, if you don't have much aldosterone being released, then you start peeing out sodium. If you're peeing out sodium, then your blood sugar will actually, not your blood sugar, but your plasma blood levels will actually decrease, and you'll have less blood going to the brain. So that's really important. So that's why I typically have patients start drinking about or intaking about 1 to 2 teaspoons of salts, typically Celtic salt, Celtic sea salt every day in water and food, because then once we so once we jack up the blood plasma levels, you actually begin getting more blood flow to the brain. It makes huge differences at the very beginning. Then you have another layer, the second layer, which is going to be, let's take a look here. The second layer is going to be responsible more for sugar, for managing sugars. So if your adrenals aren't doing well, that can set you up for diabetes. So this is one reason why women, when they're pregnant, there's a lot of stress on the adrenals, and so they tend to have diabetes right after they give birth, or even during their pregnancy. And then secondly, again, we have this layer which releases testosterone. Well, it doesn't actually release testosterone and estrogen directly, but it manages the testosterone and estrogen down the road. Let's see here. So next, we have some clinical observations. So the question I have is, all right, so I went through a little bit of the anatomy and a little of the conditions for adrenal fatigue syndrome, what it looks like. Now, my clinical observation, what I ask is, okay, where's the stress coming from? Because as a doctor, what I want to do is I want to locate the stress. Once I remove the stress and give the body the nutrition that it needs to rebuild itself, then the body can simply heal itself. So these are some common things I see with a lot of patients. The first thing that's really, really common is the hiatal hernia. With the hiatal hernia, if you have an issue with that, then that can you can have gut issues, gas, bloating, a distension in the belly. So that's one stress that's really common. The second one is really common is gluten. Just with the genetically modified foods these days, gluten is a protein that is genetically modified. A lot of the food in the wheat and the rye and the barley, so that it can't, so it can't be broken down and becomes a toxin. And the gluten tends to encode the insides of the small intestines and large intestines, so that you can't absorb the nutrition that you need, and it actually begins acting as a toxin. It can lead to leaky gut syndrome and many other things as well. That's another thing I look at. The third thing I look at, it's very important, are the toxins. So what toxins are you surrounded by? Well, I mean, you have toxins at work, you have, when you drive, you have vehicle emissions, you have the cosmetics that you wear every day, the plastic that we eat out of. So there's a variety of toxins, and so I'm able to locate, identify which toxins are stressing out the body and deal with that. Another one that's really common is just simply emotional stress. So if you have a lot of anxiety, if you're constantly in fight or flight, then that's going to lead to a degradation of serotonin in the body. And if you have less serotonin, then it leads to more inflammation in the brain. And so I can treat emotional trauma. You have PTSD, you have people who, for instance, it's not just soldiers who come back from the military. You have people who've gone through some traumatic event. It could have been a car crash, it could have been a physical attack. And this trauma, and what researchers have shown us, is that this trauma actually stays in the body until it's actually dealt with. So unless these stressors are taken care of, then the adrenals will be overtaxed and lead to the symptoms that we just talked about. Okay, next we're going to look a little bit at treatments. So we've went over the anatomy, we've gone over the conditions for adrenal fatigue syndrome. Now these are right. So these are some treatments I've found to be very helpful for my patients. Now for the emotional, there's a lot that's going on, but it actually goes into the you start getting into the spiritual, because at this point, if if you have the philosophy that you're in charge of everything, that everything that happens to you, you're responsible for, and that you're supposed to be in control of your environment, then that leads to a lot of stress, and also leads to, it's a common cause of addiction. So addicts, when they when they're trying to get recover from an addiction, you have the 12-step program, Alcoholics Anonymous, that deals with just addictions in general. And with this, you want to identify a higher power, whatever that higher power may be, and submits to the will of that higher power. And so in a sense, you're giving over your control to whatever higher power it is that you found to be worthy of that title or position. And that helps people with their emotional stress and dealing with crisis in their life. And then I also do a lot of homeopathy. Helps take away the anxiety. And let's see here, as well as Bach flower remedies, but I'll talk a little bit more about that. Secondly, one really important way to deal with physical stress is simply to exercise and to get lots of sunshine. I mean, that's not a big, that's a kind of a no-brainer, but they say is if exercise was a drug, then you'd have patients, just like breaking down doctors' doors trying to get it, because it's so helpful in actually removing stress from the body. Third is chemical. There's some medicine called, there's a system of medicine called nutritional response therapy, and through it you're able to figure out exactly what's stressing out the body. Is it fungi? Is it viruses? Is it particular parasites? What chemicals it may be, what toxins it may be, even what food allergies. You can identify what these chemicals, what these stressors are, and you can figure out like which system. It could be the lung system, it could be the kidneys, it could be the colon, it could be the brain, and you can figure out like which system is being overly stressed, and also what herbs or what supplements are needed to treat that system. And if you drink coffee, I mean, coffee isn't something I'm going to recommend. If you do drink coffee, at least make sure it's organic, and hopefully, I know decaf has a bad rap, but try to make sure it's decaf. And so part of what I do is I try to identify what the toxins are, and then I try to remove the toxins, and then we build up the adrenals with the correct nutrition. Okay, let's talk a little bit about lifestyle. What I typically recommend to patients is if they're recovering from adrenal fatigue syndrome, I try to put them on a ketogenic diet or intermittent fasting. If you want to learn more about that, you can check out Dr. Berg's channel on YouTube, and he talks about the healthy ketogenic diet, intermittent fasting. It's very effective, and I also recommend large amounts of raw vegetables. In terms of movement, yoga is excellent, especially for women, because you're reconnecting your body with your emotional, your mental space. There's a disconnection between if you're no longer grounded in your body, so to speak, and that leads to a lot of, you might say, flightiness or anxiety or a sense of disconnection. Let's see here. And then just in terms of your lifestyle, in terms of your thought life, I recommend patients, if they have a spiritual discipline, that they really give themselves into that spiritual discipline. And again, Bach flower remedies are very, very effective. They're homeopathic, and what they do is there's multiple flowers that give off particular essences. These essences can be used to help treat unconscious limiting beliefs. And I've used on patients with a lot of effect. So it's very subtle. It's very effective. So we'll talk about supplements now. This is probably going to be more of what people are really interested in. So in terms of homeopathy, I have another class where I just go over homeopathy, what it is, and how you can use it at home. So I won't go into much detail now, but I'll let you know it's very safe. Homeopathy is used in the hospital system in multiple countries, in let's see, Mexico, India, and multiple European countries. So, and it's very safe. You can give homeopathy to little children. It doesn't interact with any medications. In fact, I had one patient who, it's very effective. I had one patient who had seizures. She had epilepsy, and she was having multiple attacks. She went to a medical doctor. She couldn't get in. And so I gave her, found which homeopathic remedies would be helpful for her, made a tincture, gave it to her, and she was much, much better afterwards. So anyways, for homeopathy, I typically recommend Ignatia, Kaliphos, arsenic album, coffee cruda. You can get these typically at Health Hut or any well-stocked food store or health food store. The herbs that I recommend, and these herbs are going to help to actually build up the tissue in the adrenals. I'm going to recommend nettle, ashwagandha, ginseng, rhodalia, schisandra, and holy basil. You can probably go to a herbal store and find, you can like make a tea out of all these herbs, or simply get these in multiple. You can actually get supplements that have a compound of all these different herbs. In terms of minerals, I usually recommend calcium, magnesium, manganese, zinc, because the nervous system tends to be in a state of inflammation, and so this helps calm things down. In terms of food, one thing that's going to really help build up the adrenals are lots of vegetables. Now, a product I recommend is called Greens First, and you can get it on Amazon. You get different flavors, chocolate, I think berry. And one scoop of this stuff is equal to 20 cups of fruits and vegetables. Most people don't even get that much in one whole week. So I really want to build up the adrenals. So that's another thing that I recommend. So there you go. So that ends the do-it-yourself part of the class. Next, I'll just give you a little brief overview of how I tend to treat patients in my clinic. So let's give you a little bit of an overview. So these are some of the tools I use, and I'll go over them more specifically. I do iridology, homeopathy, applied kinesiology, and with applied kinesiology, we'll go over it briefly. I even have a class on actually these two, applied kinesiology and homeopathy. But with applied kinesiology, I mean, essentially I can it's a diagnostic system. I can look at your hormones. I can see if you have any biofilms which are little protective capsules that the germs hide in. I can see if you have any yeast infections, any heavy metals, environmental toxins, any food allergies, and any microorganisms like bacteria, parasites, viruses, fungi. And it also includes just chiropractic adjustments. And what applied kinesiology does is it allows me to see the whole system, the organs of the body, the nervous system, the flow of the blood, even the flow of the energy in the body, and to find the stressors and to correct them. Next, I do Bach flower remedies, and I do meridian therapy. So with iridology, I found iridology to be incredibly effective with patients. So again, this is a diagnostic system. By looking at the iris, by analyzing the iris, I can see the different organs of the body. I can see the brain, I can see the kidneys, the lungs, I can see the liver, the gallbladder, all represented in the iris. I can see how the blood's flowing. I can see which organs are weak, or which organs, or if there's constipation. I can see where toxins are being deposited in the body, etc. So it's very effective, and I can see things right away. In fact, they used to practice iridology in hospitals in the 1920s, but they stopped due to the pharmaceutical clout in this country. Next is homeopathy. Again, it's very safe, it's very effective. It's very common in India, Mexico, and other countries, part of the mainstream medicine. Um, what it does is it takes an active ingredient and it dilutes it to such a degree that you won't be able to find that active ingredients in in any sort of chemistry lab. So right now we're dealing with the um, the energetics. We're dealing with the flow of energy rather than the biochemistry of the body. It's very effective. In fact, there's one very common homeopathic remedy called arnica, and surgeons commonly will put their patients on this after a surgery because it will reduce the bruising, increase healing by over like 50% after surgery. And homeopathy is it's very effective for dermatology and things that modern medicine, pharmaceutical medicine really have absolutely no handle on. Next, I do nutrition and herbology. I can figure out exactly which system of the body is weak and exactly what supplements will be helpful to build up that tissue or those systems. So I'm not guessing, which is nice because a lot of times you go to the food store and you think, oh, I'll get some ginkgo or you get some Arginex or maybe some vitamin B12, and you're just guessing. You really don't know. But I can figure out exactly what the body needs and give it to it. Even figure out like how much it needs, how many pills per day you should be taking. Again, you have applied kinesiology, which is a very one of the most effective, most powerful systems medicines I've ever run into. So what it does is it actually takes multiple systems of medicine: osteopathy, chiropractic medicine, Chinese medicine, let's say herbology, naturopathy, and combine it together. So what it does is applied kinesiology again allows you to identify the chemical stress, the mental stress, the structural stress, and to eradicate it quite quickly. In fact, the gentleman, the doctor who came up with applied kinesiology was Dr. Goodhart in the 1960s. In fact, it was so effective that Dr. Goodhart was the very first chiropractic doctor that was invited to treat patients in I believe it was the 1974 Olympics. Next, we do in-house testing. So a lot of times you'll spend hundreds of dollars having your hormones tested or having your blood tested. So in-house, I'm able to get an idea of how your hormones are doing, how the levels are, if they're high or if they're low. Look at your yeast. I can look at biofilms, heavy metals, food allergies, environmental toxins. I can even parasites, bacteria, etc. I mean, I had one patient who, she was a doctor and she couldn't practice for years because of some gut issues. And using iridology, I was able, and using in-house testing, I was able to figure out a couple of things. One thing she had was parasites. And once we were able to take care of that, then she had much more energy, and she was able to treat many more patients. So next is Bach flower remedies. I talked about this already a little bit. So this really helps patients who have emotional stress or PTSD or limiting beliefs or limiting unconscious beliefs. What they say is 80% of our emotion actually comes from unconsciousness. So I can figure out exactly which remedies will be helpful for a patient, make a tincture and give it to them. And oftentimes it's very effective. It's subtle, but they find the changes are very effective. Next is meridian therapy. I can essentially the body is like a large battery. You have flows of energy through it. So I'm able to figure out. I'm able to look at the flows of energy in the body. I'm able to see which meridians are blocked, and I can unblock them. I'll tell a story. I had there's one patient, one of my colleagues, and she had diarrhea, and it was really bad. And he found that there is one there's a meridian that was being blocked. So after adjusting one toe on the left foot, the diarrhea just disappeared. So the changes can be very dramatic. Oftentimes I can use meridian therapy to help with a whole series of emotional issues like grief, anger, sense of worthlessness, etc. I don't puncture the skin, but I do tapping, I use lasers to activate these meridians. Okay, so last here's so if you want if you so that was a plug just for my office, for my clinic. If you would like to give me a tryout, here's just a $10 coupon for you. You can use the coupon code seminar when you go to book online, and it'll just take $10 off. And well, I hope this was helpful, and I hope to see you later on. All right, take care.